If you have an infant or a toddler, there's a decent chance that they're going to hit their head at some point. Head injuries are one of the most common reasons that kids come to the ER, and not all falls are the same because kids fall from different heights, they fall into different types of surfaces, the mechanisms are often quite different as well. So I'm going to walk you through all the different things that we look for when kids hit their heads when they come to the ER. So the first red flag would be if they've had any true loss of consciousness, and I mean that the kid was out cold for any duration of time. The second is vomiting. And the reason that we care about vomiting is that it may indicate that there's swelling in the brain. And for infants that are breastfeeding or bottle feeding, I'm talking about a true episode of vomiting, not just a small spit up after a feed. The next one is if you run your fingers along where they hit their head and you feel that there's actually a small crater or there's a significant amount of swelling that feels kind of like a squishy, wet dish sponge. These are concerning features that there may be a skull fracture. The next one is if there's any change in the kid's behavior or they're just very drowsy. And lastly, we care about the mechanism. So for kids under the age of 2, if your kid has fallen from over a height of 3 feet, if they were riding their bicycle and fell without a helmet, or if they were struck by a car, all of these mechanisms have enough force to cause significant amount of damage to the brain. So all those things that I just listed are all definite reasons that you should bring your kid to the ER for an assessment. And the best case scenario is the one that I most commonly see, and that's when a toddler is running and trips and hits their head, but they cry immediately. You're able to quickly console them. You give them a snack and some juice, and they eat and drink fine without any vomiting, and then they go back to playing and behaving normally. These are all very reassuring features, and even if they have a small scrape or a bruise where they hit their head, it probably wouldn't warrant a trip to the ER. Obviously, it's going to be a little bit more tricky with an infant who hasn't learned how to speak or crawl, but typically what I'll do is I'll use a toy that has a flashing light on it and kind of move it around their visual fields to see if they're tracking and to see if they're actually maintaining decent eye contact with you as the parent. And the other thing that you can try is bottle or breastfeeding them and see if they're able to keep it down without any episodes of vomiting, because these would be reassuring features. So save this video for later and share it with your parent friends because it might be able to save you guys a trip to the ER.